Phosphoric acid cement is a type of dental cement used in acid dentistry for various applications, particularly in restorative and adhesive dentistry. It is also known as phosphoric acid etchant or dental etchant. Phosphoric acid cement plays a crucial role in the preparation and bonding of dental materials, such as composite resin restorations. Here's an overview of its uses and benefits in acid dentistry. Tooth surface etching. Phosphoric acid cement is primarily used for etching the enamel and dentin surfaces of a tooth before the placement of restorative materials like composite resin or dental sealants. Etching creates a microscopically rough surface that enhances the adhesion of these materials to the tooth structure. Enhanced adhesion. By etching the tooth surface with phosphoric acid, the cement creates a stronger bond between the dental material, example composite resin, and the tooth. This improves the longevity and effectiveness of restorations. Microscopic surface changes. Phosphoric acid removes the superficial layer of hydroxyapatite crystals from the tooth surface, creating a porous and irregular surface. This allows the adhesive materials to penetrate and bond effectively, ensuring a stable restoration. Selectivity. Phosphoric acid etchants are highly selective, primarily affecting the enamel and sparing the dentin. This selectivity is crucial to prevent damage to the sensitive dentin tissue while enhancing adhesion to the enamel. Different concentrations. Phosphoric acid etchants are available in various concentrations, usually 30 to 40%. The choice of concentration depends on the specific application and the dentist's preference. Rinsing. After applying the phosphoric acid, it is essential to thoroughly rinse and dry the tooth before applying the adhesive or restorative material. This ensures that no residual acid is left on the tooth surface, which could lead to post-operative sensitivity or compromised bonding. Safety considerations. Dentists must use phosphoric acid etchants with caution, taking appropriate measures to protect the surrounding tissues, example gums, and ensure patient comfort. They should also wear protective gear to prevent contact with the acid. In summary, phosphoric acid cement is a vital tool in acid dentistry, particularly in the field of restorative and adhesive dentistry. Its ability to create a suitable tooth surface for bonding and its selectivity make it an essential component in modern dental practice for achieving durable and aesthetically pleasing restorations.